Thank you, everybody, for joining us. We're going to give it one more minute. Welcome to the third workshop, Age Your Way, Caregiver Resources, Part 2. We had a Caregiver Resources, Caregiver Information, Part 1, with one of our speakers today, Jackie Boyd. So she's back again today to join us. All right, we're going to get started. Hello, I'm Andrea Spencer, and I'm Vice President of Communications here at ElderSource. I am one of your facilitators and speakers today, so I'm so glad that you joined us. Next slide, please. A few housekeeping items for today's session. This is being recorded and it will be posted to our website for those who are not able to attend or for those who want to collect more information, take additional notes. So we're happy to have you log on to myeldersource.org following today's session. We are using the Zoom webinar format and where our members of our audience are muted and you're not on camera, but we're encouraging you to make sure that you put your questions in the Q&A portion of the webinar screen. So we'll be having a Q&A session toward the end of today. All the resources that we're mentioning today will be shared in a follow-up email with you, and they will be found again on myeldersource.org. There's going to be a survey at the end, and of course we want your feedback, and we welcome it. We want to make sure that these sessions are meeting your needs, and if there's any other topics or information that we can share with you following the webinar. So due to the number of attendees, sometimes we have those technical difficulties, so we ask that you be patient and we'll do our best to fix any issues. So thank you again for joining us. Next slide. Our workshop facilitators today, myself, Andrea Spencer, Vice President of Communications at ElderSource, and a wonderful colleague and friend, Cheryl Wayland, who's Director of Special Initiatives with SAGE. I want to give you a quick little explanation next slide, please, as to why ElderSource is structured these workshops and offering these workshops. It's a special initiative to provide important information and resources from these subject matter experts so that our LGBTQ older adults have access to them so they can live their best lives and age their way. Cheryl, why don't you share with us a little bit more about the workshops?
Thank you so much, Andrea, and I'm just really excited to be here again today. As Andrea said, we've been partnering on these workshops over really the past year in developing the content and our speakers. And we're just really excited to have folks here again today. We do have a total of 5 workshops that we're offering, and they're really designed to help provide you with information and resources to prepare you to really age well and to age your way. Our topics include legal decisions and preparation, being a caregiver and how you want to be cared for, financial preparation, and overall health and well-being. Our goal is for you to use the information from the subject matter experts and the SAGE and ElderSource websites to line up what you need and to help you make the best decisions possible. And I'll be sharing more about SAGE as we go through the presentation today. I'm excited to introduce Jackie Boyd, who is our content expert today. And I think we have there we go, thank you. So Jackie brings a passion and expertise to the field of aging and LGBTQ+ advocacy. Jackie is a dynamic speaker, facilitator, and entrepreneur. Jackie is the owner of the Care Plan, and the Care Plan is the country's first LGBTQ+ centered care management and care development company. The Care Plan's innovative model of client-directed care provides advocacy, care navigation, and advanced planning for successful aging experiences, as well as organizational support for businesses looking to develop a dynamic culture and care for clients and workers alike. Jackie's going to be joining us today, and I'm also going to be a speaker on this presentation today, providing you with more information about SAGE USA and some of the supports and services that we offer to caregivers across the country. And finally, Andrea Spencer, Vice President of Communications from ElderSource, will present resources available to caregivers and families residing in Northeast Florida. She's been with ElderSource for 10 years, and one of the many responsibilities that Andrea has is to ensure that older adults and their caregivers living in Northeast Florida are connected to the resources so they can live and age with independence and dignity in their homes and communities. And with that, let's get started with Jackie. Jackie, welcome to the show today.
Thank you so much, Andrea and Cheryl and the whole team. Really, really appreciate your help in setting up these workshops. And everyone, it is wonderful to be with you. I'm Jackie Boyd. My pronouns are she, her, and they, them. And I want to encourage you, if you have questions, if you have stories, if you have experiences you want to share, please do feel free to chime in the chat. We would love to hear from you. And we are all learners in this space. So thank you for being here, and let's go ahead and get started. So Andrea, if you cannot see my video or if there's any issues with the audio, please do let me know. But as Cheryl said, we are here for part 2 on effective caregiving. This is my contact information, Jacqueline at the-care-plan.com, should you need it. Feel free to reach out to me afterwards with any questions or if you need any of the resources. And these slides should be available to you along with the links to the specific websites and resources listed here. So what are we doing today? We are ideally going to gain a greater understanding of the resources available to LGBTQ+ caregivers and care recipients. I want to be sure that you have really practical tools for effective planning and care provision, and learn best practices for how do I find resources? How do I find somebody who's going to be LGBTQ+ affirming, or a geriatrician that knows their stuff and has good bedside manner? There's a process by which you can find trusted service providers, and I want to be sure that you get those tools and tips today. So when I think about caregiving, and I've had the honor and privilege of being a caregiver for over 20 years now, both professionally and personally, I think it's really important to look ahead at aging. Aging goes better with a plan. Likewise, so does caregiving. But it starts with our personal desires and wishes. And many people don't ask themselves this question, but this is always my centering question for any client I'm working with. What are your goals? What are your priorities? And if you're a caregiver and you're thinking, gosh, have I ever asked my loved one about their goals? What quality of life means to them? That's the starting place, because everything else grows from that. Right? Who your medical team is, what your care support looks like. Is it at home? Is it in senior housing? Is it with family or friends? How you eat, whether you exercise, what services you want to engage with. All of that starts from a place of who is this person? What are their priorities and goals? And how can I best support them to have that quality of life? As we all know, there's a lot of challenges with aging and with illness and with disability. Some of the pictures you see on the screen are getting at those challenges. Money is often an issue. It's very, very expensive to pay for care. And I've seen just in the last couple of months with inflation, rates, say that you want to hire a caregiver. Those rates have escalated sometimes by $5 or $10 an hour. So the financial piece is a major concern for many people. The good news is that there are services that you can access at any income bracket, but planning ahead and understanding those resources is what will win the day. Some of these other pictures are getting at issues like chronic pain or being on a lot of medications or having medication interaction. Those things can make the process of aging feel even more challenging. Dementia, memory loss, cognitive impairment, those are certainly challenges that we want to be thinking about as we plan ahead for aging. And then this picture down here at the left is getting at the reality of the systems we interact with. Signing up for Medicare every year, understanding your options, that by itself, that one task can feel overwhelming or confusing, especially for a senior. Going to the hospital, understanding what's the chain of command, how do I advocate for my loved one? The system side can be particularly challenging, as well as being a part of a marginalized community, making sure that you receive the care that is in line with your needs and your values. As an LGBTQ plus person myself, I really try to not just talk about the disparities and the difficulties we have, but to remind ourselves that we have a long history of caring for each other. Our communities are really remarkable in the ways that we show up, problem solve, and support one another. And this is, there's strengths here and sometimes missed opportunities because, for example, even the term caregiver, a lot of the folks that I work with in community don't identify themselves as caregivers. They're like, oh, I'm just helping my friend, or I'm taking care of my ex after surgery, or, it's just what you do as a partner. So understanding that there really is a role, being a caregiver is a role with certain responsibilities and opportunities. Sometimes we can miss out on things that are built for caregivers just because we have our own language and the way that we talk about what we do and how we show up for folks. We are, by and large, very, very unique in having such a dedicated history around chosen family, right? For many of us, we have those friends, those loved ones who have been there for us that may not be family of origin. And planning ahead for aging and effective caregiving means bringing those people into the fold, into the loop, making sure that everybody's working together. We have high rates of direct caregiving that we provide. We have given each other places to stay, resources, informal networking, and in many cases, LGBTQ plus folks start their own organizations. So I want to encourage you, wherever you are at watching this, take a look at what's happening in your area. Connect with the local SAGE affiliate or the local LGBT center or the LGBT Chamber of Commerce to understand, okay, in my particular area, who can be a resource? What's available? Because it's unique across the country. There's different opportunities in different areas. So let's talk about the aging process, because this is where oftentimes I find caregivers and care recipients get confused because we're not really taught about what aging and dying looks like. So I just want to be sure we have a foundation of, gosh, if I'm setting those goals for the last 10 years or the fourth quarter of life, or I'm caring for someone in that stage, what should I expect? So the aging process, I view it like this. The aging process begins at the point of adult maturity. For most of us, that's our late 20s, 27, 28, in that early adult stage. So 0 to the late 20s, we're getting stronger, we're growing, our brains are maturing, we're kind of on this upward trajectory. Early adulthood till about middle age, the body experiences slow decline. This is different if you get a particular diagnosis or if you have chronic illness, but by and large, the body's capacity stays stable, declining a little bit over the years, right? That's when you wake up with aches and pains, or you don't heal quite as quickly as you did when you were young, or you have to take your diet and exercise regimen a little bit more seriously to feel good in your body. For most communities, older age is considered 60 and up. We consider it 50 and up in marginalized communities, groups like LGBTQ plus folks. And advanced age, we're talking about people over the age of 80. So older age can encompass many decades. It's this stage of life that typically people need care or are planning for care. So this is what we're going to focus on today. And then death and dying is the final stage of the aging process. And I want to spend just a minute there so that we're really clear about where those options are for choice. In the first caregiving workshop we did with Ocean about a few weeks ago, we talked about end of life, and Ocean, as a death doula and spiritual guide, was discussing how do you know when you're in this stage of life. As a caregiver, I look for decline without rebounding. So what that means is if I see a client, again, we're in that adult stage and we're doing okay, but we're losing some of our abilities, and then there's an unexpected medical crisis or a fall or an injury, something that happens that declines our abilities physically or cognitively, and then we're trying to get back to baseline, right? That might be an example of someone who is doing okay, and in their 60s has a heart attack. And then they're okay for a number of years, and then they have another heart incident. And then they're okay for another year, a few years, but then they get an infection or pneumonia or a fall. When you reach that point where there is a medical crisis once a month or once every 2 to 3 months, the person might be in a stage where they need palliative care, or they're entering the dying process where the body is declining and not going to bounce back. That is the stage where you want to be sure that you understand your loved one's wishes, because you'll be at a crossroads. The medical community can do amazing things. We have to come to them though. So at that crossroads where the person's body is declining and there's not a lot of hope for improvement or stabilization, the physicians involved, the medical team can outline, here's what you can expect from us. Here's the treatments, here's what we'll do to keep this person alive. The other pathway is to think about it from a palliative approach or a hospice approach around comfort. I know, for example, with many of my clients, they reach a point at this stage where maybe they're sleeping all day long, they aren't very hungry, don't eat very much, their verbal skills start to decline, and we're dealing with something medical every month. And they start to tell me, I don't want to go to the hospital. I don't want to be poked and prodded. I just want to be at home and I just want to rest. That kind of language helps you know where your loved one is at in their aging process. So I won't spend too much more time on that, but just wanted to give you a basis that, aging is very natural. Death and the dying process is natural. Most of us just aren't necessarily taught about what that looks like. So if you have questions later, reach out to me. And again, this is just from my perspective as a 20-year caregiver. I've worked with hundreds of people directly around aging and death and dying, and those are just the patterns that I've seen. A few reminders in this planning piece as the perspective of the caregiver or person who will need care. These were the reminders we gave last time, that there's 5 steps. Identify the needs and wishes of the person, right? Those goals. Identify who can help, who's the team, that chosen family, those friends, those loved ones who can participate in the care. Start the conversation, right? Caregiving can feel very, very isolating. So that's why it's important to build a team and to let folks help. So start that conversation with people that are interested, that want to support, and then put together and implement the plan and adjust as needed. We'll come back to these a little bit later. Today, I want to be sure to give you all the resources that I can in terms of a starting place for what may help you care for your loved one with dignity and compassion. So when we're in this care planning space or trying to find resources, these are 5 of the most key areas. Where does the person live, right? Are they in the right location? What will their finances afford them? It's not that, if you don't have money, you don't have choice. You still have choice. For example, say that you're someone who is Medicaid eligible. Well, there are a lot of Medicaid skilled care and rehab facilities, and they're not exactly alike. Sometimes Medicaid facilities that accept Medicaid get a bad rap for having less quality care. That's not true in my experience. The surroundings might not be as lush or luxurious, but oftentimes the care is just as good as a private pay facility. But you do want to do your research. So that's, again, that planning ahead lets you know within my financial bracket, what are my options? Because you don't want to just leave it to chance. The legal considerations, which we talked about last time as well, and there was another workshop on around advanced directives, estate planning, and end of life considerations. Health, who's the medical team? Who's in charge? Who's advocating? Do you have everybody on the team that you need? Are the medications being managed? And what other health needs should be addressed? And then care. Who's actually going to show up to do the care? Sometimes that might be friends or family. That might be somebody who's paid as a caregiver, might be working with an agency or a Medicaid covered facility. It just depends. So these are kind of the 5 general areas. There's also, I would put under care things like spirituality, socialization, hobbies. There's a lot of other things you might be thinking of, but these are kind of the 5 general areas you want to consider when you're care planning. There's a lot of transitions that happen when you're caregiving. It can be, apologies. What is happening? Can you all hear me okay?
Yes.
Okay, so sorry for that disruption. I'm not sure what happened. So sometimes care planning and these resources may come into play during times of transition. I'm always going to suggest plan early, plan often. Having seen so many people go through these stages of life, I picture it as doing one of the most important jobs of your lifetime without training, right? Most of us don't get training to be a caregiver. So we worry the whole time. Am I making the right decisions? Is there anything I've missed? Would this person be better if I did this, this, or this? There's so much concern because oftentimes we haven't planned ahead. We haven't been educated about how to do this well and what to expect. So again, I want to thank ElderSource and Sage for putting on these workshops, because that's really our goal, is to help equip you to know well ahead of time, what are my options? So my recommendation is going to be, don't wait until these transitions. The time to make decisions about your finances or your housing or your care is not when you're already in the hospital, because you'll only be working from stress and urgency and fear, not from, gosh, what of these places will be best for me? Where am I going to be most comfortable? How can I make sure my team shows up for me and knows how they can connect? But these are some transitions where even if you've done the planning, you might need to adjust the plan a bit. So where do we find support when we're caregiving for a loved one? Family and friends are the first place to start. And I encourage you to not make assumptions about other people's capacity or motivations. That's because when we make assumptions, we leave people out. And this is a mistake many people make when they're in need of care anyways. Have you ever heard anybody say, well, I didn't reach out because I didn't want to be a burden. I didn't want to bother you. I thought I could do it on my own. Though that kind of thinking, that sort of isolationist, it's me against the world and I have to take care of myself thinking, does not serve us, and it gets in the way of having meaningful connection and relationship as we age. So I really want to encourage you, whether you are looking to build a team or you're a caregiver and you need support, reach out to those family and friends. Explain, here's where we need help. Maybe we need help with transportation or pet care or laundry once a week, and ask people if they have capacity to show up in certain roles. That's the way to be most effective in finding that support. But you don't want to discount anybody. Invite anybody who's ever offered support, who is close to that loved one, who might have capacity to talk it through, so that, even if they can't come help, but they can make a call once a week and give that loved one time to laugh and joke. That's a value. That's really important. So family and friends, usually the first stopping place to find support. And then there might be things in your community. For example, here in Chicago, we have a number of local LGBTQ plus focused organizations, groups like the Transformative Justice Law Project, that is specific to our community, works here to help people who are trying to change their name do that legally. They walk people through the whole process. That's a local organization, not a national one. So you in your area will have local community specific options and advocates that you can rely on. There's city or state programs geared towards elders and their caregivers, federal programs. There's often medical avenues to find support, legal resources. There may be free services in your area to be able to get some of these tasks and planning done or to advocate for you. And then housing. So let's talk about federal resources for a minute. There's the Area Agencies on Aging. And, and Andrea or Cheryl, if either of you want to jump in here, please do. But the Area Agencies on Aging are like the go-to for what is happening in your region for elders and seniors. There's a lot of programming that they offer, and they have just an amazing network of resources and opportunities for seniors to connect and for their caregivers. Andrea or Cheryl, anything else you want to add there?
I do cover some of the things you're talking about, Jackie, in my presentation, but the one slide, it just occurred to me that I don't have in there, and I'm certainly going to make sure I add it as a resource, but we have a veterans directed care program where veterans who through the VA, through their primary care physician, can tap into a program where they can hire their own caregiver. So if you could hire that family member, a neighbor, anybody to provide that care and support that you need. So I will make sure that as we go forward, I will put that information in the resource, which will be on our website, myeldersource.org. But I'll touch on that Medicare support, understanding your Medicare benefits. There's a couple of good slides that I'll be sharing shortly.
Thank you kindly.
Yeah, and Jackie, I would just add real quick, whenever I get a call at SAGE for the National Resource Center on LGBTQ plus aging, one of the first places I recommend that people reach out to for support is their area agency on aging, such as ElderSource. If your community doesn't have an LGBTQ older adult program or community center, you will be served by an area agency on aging. And so that is really a go-to place, I think, to start our journey when we're thinking about services and supports available for older adults.
Absolutely, absolutely. Thank you so much for chiming in. And everybody, these are hyperlinks. When you get the slides, these are links that you can go to connect to your local area agency on aging. In terms of veterans benefits, there's a number of programs and services to support veterans that, again, I think have been really, really helpful for many of my clients for a number of reasons. One being financial. If veterans qualify, if they are in if their service is in a qualifying period, they might be able to get services through the aid and attendance program, which pays for that caregiver support in home. People also access the VA for medications, primary medical care. I have seen clients significantly decrease their expenses and also connect to their veteran community through receiving services at the VA. I've even had clients who applied for and were able to get a pension that helps support, again, their care needs as they aged. So if you're a veteran or your loved one is a veteran, please do look into those benefits. Call your local VA office to get started or work with a group like ElderSource, because those benefits are there for your wellness and they're really good and very, very helpful. Social Security, it's just important to be sure that you have your Social Security lined up, that you are using the online portal if at all possible. Sometimes you can get an increase if you have a disability and you're an older adult. So just pay attention to what's going on with Social Security. They have a lot of great tools online in their portal to help manage your care and manage Medicare benefits. And then insurance navigation. After the Affordable Care Act, I'm going to see if that goes where I want it to go. There's this website, healthcare.gov, where you can find a resource for insurance navigation. So if you're like, what is the difference between Medicare and these supplemental policies? How do I sign up for services in my region? This is the website that you can go to. You can type in your zip code to be connected with free advising around insurance benefits. So I hope that that is helpful. Give me one moment. I want to be sure to get back to the slides. I see that there's Cheryl, you had a question. I'll come back to that towards the end. We could have a whole workshop on Medicare. We're not going to do that today, but I just wanted to be sure to give you, if you're a caregiver or a care recipient, just the basics around Medicare and how it can help you. So Medicare Part A, it covers inpatient hospital care, skilled nursing facilities, things like hospice, lab tests, surgeries, home health care. Part B is also really important. So oftentimes when people are signing up for Medicare, it can feel like a maze. Signing up for Part A and Part B is very, very helpful because Part B covers your doctors, your healthcare providers, outpatient care, durable medical equipment, and some preventative services. Part C covers Medicare Advantage plans. Those can be very confusing. I definitely encourage you to work with an insurance navigator or someone who's very skilled and knowledgeable. And then Part D is prescription drug coverage. So Medicare is our federal program around healthcare for our older adults and people with like end-stage renal failure or on disabilities. These are services that I want to be sure you know about because these are covered by Medicare. It's not anything extra you have to pay or do. And these services, when used intentionally, can help ease the stress of not knowing, am I doing the right things? Is this person receiving the best care? Using the fullness of your Medicare benefits really, really helps build a strong team. So for people who have Medicare, a primary care physician can be covered. Geriatricians are folks that specialize in the care of people over the age of 75. So for most of my clients, when they start to reach that point, I definitely recommend that we try to get a geriatrician, or if they need an in-home visiting physician, so that they have somebody who understands the ways these medications can interact, the aging process. And oftentimes geriatricians are really strong advocates because they've intentionally worked with seniors and they know that seniors need more support or are likely to have health issues that require advocacy. Anything you see starred here is a service that you can receive at home in most areas around the country. It may be different if you're in a very, very rural area, but a lot of these services you can get in home, like a podiatrist. Medicare also covers different kinds of specialists, pharmacy care, hospitals stays, obviously, as we saw on the previous slide. Home health. Home health is an amazing benefit that basically provides rehab services at home. So for example, I've had clients who were terrified to go to the hospital, terrified to go to a skilled care facility or a nursing facility. And they say, nope, just take me home. I don't want to go anywhere else. Fine, I went to the hospital. I've got to heal from this injury. Take me home. We have to have home health in place. Home health will provide a nurse, a physical therapist, if necessary, a speech therapist, an occupational therapist, and even a social worker to help support that loved one staying at home and regaining their abilities. So if you remember that aging process I talked about, where like there's a health issue that impacts somebody's wellness and they start to decline, home health is really helpful then and is often prescribed then, but you can have it more frequently. I'll give you an example. My grandfather is in his 80s. He has congestive heart failure, had bypass surgery a number of years ago. And so his heart just, runs a little slow. And he has recently started sleeping all the time. He is getting some wounds on his feet and his mobility is suffering. And we met as a family and decided, well, let's try to get home health back in place. Because he did really well when he had it. He's not the kind of person that's going to get up and exercise on his own. He really needs that support and that coach to get him motivated. So we got home health back in place and he's back at his baseline, more active, more mobile, more alert, more oriented. Palliative care is really a wonderful underutilized service. In most places, palliative care is a nurse practitioner or a physician that comes to your loved one's home once a month. And their job is to look at the big picture of care, to say, okay, this is specifically for people that have chronic illness, not necessarily terminal illness, but chronic illness. So say that you have a loved one who has diabetes, and there's obviously a lot that goes along with diabetes in terms of management. Palliative care is a service that will come into the home, see the person in their environment, discuss ideas around treatment, right? Do you want to go on dialysis? Is that the right decision for you? What's the differences between these types of dialysis? What are your medications doing right now? Do we need to tweak those medications? Palliative care can last as long as it needs to. It's in home, it's covered by Medicare. And in addition to a nurse practitioner or a doctor visit monthly, they can also offer a social worker visit monthly, which I find is really, really helpful for many of the clients that we work with because they have long-term chronic issues. And then hospice care, which we talked about a little bit in the first session. And if you want more information about some of these services, you can always reach out. I also have a YouTube channel that talks about how do you choose a nursing home? How do you have these conversations around hospice? How do you build a team? So a lot of the things that I've covered here, you can revisit on our YouTube channel or join us on our Instagram because we do Instagram lives as well. People often are confused about what Medicare covers and doesn't cover. It doesn't cover long-term care, right? So if I actually need somebody to make me breakfast, help me with a shower, get me to my appointments, make sure I take my medications, Medicare is not going to pay for that caregiver typically. You have to either pay privately, sign up with a Medicaid program, or get those VA benefits. So that's the challenge that many people have, is thinking, well, Medicare will cover my costs for caregivers or when I go into a nursing home. Medicare is designed for medical intervention, not ongoing long-term round-the-clock care. It doesn't cover dentures or dental care, eye exams, cosmetic surgery, acupuncture, hearing aids, or exams for fitting them. And those are big costs. That's why I specifically mentioned dentures and hearing aids, and routine foot care. So if you are someone who is living on a restricted, fixed, or low income, you will probably have Medicare and Medicaid. And Medicaid will cover some of those other costs like hearing aids or dentures. I wish we had more time, y'all. I'm sorry. And there's a lot of information. I hope it's helpful. But I know that you probably have questions about each of these topics. So don't hesitate to reach out, to get more information, because we just can't cover everything. So this is kind of a cheat sheet on, well, if this, then what? So on the top line, you see if someone is healthy, independent, minimal illness, minimal injuries, probably not on that many medications. The environment can be their home environment or independent living, where they don't really need a lot of support. Services they might want are things like home health. Their care should be overseen by their primary care physician or a geriatrician. In the second level of care, or second stage that, we're just trying to figure out what might I need as a caregiver, this is where people require some assistance, not able to live entirely independently. The person probably has chronic illness or multiple chronic illnesses. They might be in the early stages of dementia, or they might have things like illness or falls happening a couple of times a year. This person likely is going to need some support at home. Doesn't mean they need to move, but if they wanted to move, they could, or if it was in their best interest. They might be home with caregivers or in something like a supportive or assisted living. When people start to need that help and can't complete their what we call ADLs, activities of daily living, that's when you start to need actual support in the home. Services that people might use are home health. If they do have chronic illness, you might want to get palliative care in there or some of those services at home. And then for people that require much more extensive care, this is when you need intensive assistance. Typically someone is wheelchair or bedbound. They're likely having frequent hospitalizations or physical decline without recovery. This is that crossroads point that I talked about, where, are we going to continue to go to the hospital every time something happens? Are we going to continue to try to treat everything? Or do we want more of a palliative approach to say, okay, what tests make sense? What treatments make sense? And if the person is declining relatively swiftly and we think there's around 6 months to the end of life, is hospice appropriate? Because that hospice care will provide all the medical care in home. So your loved one doesn't leave the home if they're on hospice. They stay at home. They have a nurse visit them 1 to 3 times a week. They have a CNA, a caregiver that can come out and assist with a sponge bath or a bath a few times a week. There's a social worker that can help, a chaplain, medications that are designed for comfort. Hospice is a whole world of possibility to ease people through those last stages of life, because it is difficult to watch your loved one suffer. And sometimes some people are really clear that they want to treat and extend life for as long as possible. Some people have other ideas, and quality of life may mean being at home, being with their loved ones. We each deserve that choice, but not all of us know when that stage of life is happening. So when it's time for that level of assistance, typically the person needs 24-hour help at home or in a facility. Some of the types of housing to be aware of, and Cheryl, I know I'm getting close on time, but I'll transition through these relatively quickly. Some of the types of housing, I just wanted to be sure you're aware. There's independent living. If you see ILF, independent living facilities, these might be 55 and up or 60 and up. They have ones that are private pay, and they have independent living that are subsidized. Typically not covered by Medicaid or Medicare, right? Medicare is medical. If you're independent living, that's not a service they're going to cover. Medicaid will cover some forms of housing, but it's not independent living. Independent living, Medicaid does not really cover, but there are subsidized programs that you can find. So for example, if I have a client who is 55, who, is okay on their own, but they are under socialized or they feel more secure living in a senior building, we might help them move to independent living, whether it's private pay or subsidized. But there's no support services typically with independent living. They might have a property manager, they might have a resident coordinator, they might offer a meal once a day, but that is not promised. Typically, it's just the housing, just the apartments, and it happens to be, seniors that live there. Assisted or supportive living facilities provide much more support. They're that middle tier. There's typically a nurse or a social worker available 8 hours a day. There's caregivers that can assist with things like showering, getting to meals, but the person still needs to be able to do some things for themselves and be somewhat independent. It's a moderate level of care, we would say. Assisted or supportive living can be covered by Medicaid, can be supported by veterans benefits, or can be private pay. There's things like memory care that is specific for folks with memory loss. It is very, very difficult to find memory care facilities that accept Medicaid. Those are very few and far between. So typically for somebody that needs memory care, we'd be looking at assisted or supportive living or the skilled nursing facility like you see below, because it really can be a challenge to find memory care at a lower income level. There's places called long-term acute care centers that are designed basically as an ICU or a very intensive hospital setting, but for longer term care. Anytime I hear somebody refer to an LTAC, I ask the questions about that place of choice, because sometimes you'll get these recommendations to go to a long-term acute care center for folks that are very, very compromised. And it's the treatment, it's the ongoing continuing to try to keep the body alive. And again, that's just a decision point that I think people need a little bit more information around to know, okay, we could do this LTAC, or we could, do care at home with palliative care or in a different setting. Skilled nursing facilities, when you go to a skilled nursing facility for rehab, that can be covered or in part by Medicare. When you run out those Medicare benefits, though, it would need to be covered privately or by something like Medicaid. Rehab goals are about, let me get back to my baseline. Let me get back to how I was. Long-term care, or that custodial care, is when a person requires ongoing total support for activities of daily living or has significant memory loss. One thing to note as well is there are there are veteran-specific nursing homes. And I have found that especially for my clients who are, to be honest, often older gentlemen, miss being around other veterans and other men. And those locations can be particularly good for socialization and services for someone nearing the end of life, or if they need that custodial care. So I'm going to pause there because I know that's a ton of information. Are there questions about housing before I kind of transition on? I see some things in the chat.
I think what we might do, Jackie, is we've got several that I've been collecting. So if we can put all of those together at the very end, because I think some of them can be answered by you and some can be answered by Cheryl, and actually some can be answered by myself. So Cheryl, you want to jump into your presentation? And I know that Jessica, you've got her slides ready to go.
Thank you, Andrea, and thank you so much, Jackie. You are just a wealth of information, and you're just like a walking library, I think, when it comes to caregiving, especially within the LGBTQ community. So thank you so much. Again, my name is Cheryl Wayland. I'm the Director of Special Initiatives at SAGE, where one of the main projects I lead up is the National Resource Center on LGBTQ plus aging. And I want to share just a few minutes today providing some of the resources that we have available through the National Resource Center. Next slide. So SAGE is the country's largest and oldest organization dedicated to improving the lives of lesbian, gay, bisexual, transgender, and queer and questioning older adults. Our mission is to lead in addressing issues related to LGBTQ plus aging. And we oftentimes say that we're the aging voice within the LGBTQ plus community and the LGBTQ plus voice within the aging community. So we're just really excited to be a part of this project and to share in the resources across the country. Next slide. The National Resource Center, we were first funded in 2010 through a grant by the Administration for Community Living with the Department of Health and Human Services at the federal level. And our goal is to provide ongoing and sustainable resource development, technical assistance, education, and training that supports the aging and disability networks and providing culturally competent services to LGBTQ plus older adults and their caregivers. Next slide. So we want to just take a few minutes and share specifically about some of the caregiving resources that we have available for you on our website. And our website is LGBT Aging. What is our website? I hate it when I do this. I'll come back to that. Here we go, lgbtagingcenter.org. I only go to this website every day, and I oftentimes forget my own website. But you can go to our website at lgbtagingcenter.org/caregivers and pull up some of these resources that we're speaking with you about today. Jackie was actually one of the main authors helping with our first guide here that you see, which is Create Your Care Plan. A lot of the information that Jackie has been sharing today is available within this guide. Along with that information is actually a form that helps you think about, what are the caregiving resources I need? What types of supports do I need? If I'm thinking about my own caregiving needs or the caregiving needs of a loved one. And so there's just a lot of information in this guide that I would encourage you to look at. And then Caregiving in the LGBTQ community is another guide that really is just an overview of caregiving and caregiving resources that are available throughout the country. Next slide. This is one of our newer resources that we have available, and it's how to be an ally to transgender older adults. We oftentimes are looking for information ourselves on, what does it mean to transition? What does it mean to identify as transgender? And we develop this guide to really help answer those questions and to help you, as LGBT community members, as friends and family of someone who may identify as transgender, to have a baseline understanding of what this means and how you can better support your friends and loved ones who may identify as transgender. So we would encourage you to take a look at this guide. We also include a section on interacting with long-term care communities because we oftentimes see that transgender older adults face a lot of discrimination and stigma within long-term care systems. So it's important that we have an understanding about their needs so we can better support them in these situations. Next slide. I also wanted to just share a few minutes to share about some of the programs that we have available through SAGE. One of our programs that was started as we started to see COVID take shape and actually start to close down a lot of our in-person programs, we saw a need to help address social isolation for LGBTQ community members. And so we started a program at SAGE called SAGE Connect. And this is a friendly phone and video support program that matches LGBTQ older adults with community volunteers. And it provides a once a week friendly phone call, just an opportunity to check in and see how folks are doing and continue to support relationship building across the LGBTQ plus community. This program is free and available nationwide, and you can learn more about this at sageusa.org. Next slide. Another program that we have is Sage Sense. And, Jackie has talked a lot today about planning. And part of that planning for ourselves and our friends when we think about aging is financial planning. And Sage Sense is an app-based program that's designed to help us think about our own financial health and well-being. And through this program, we've actually seen that a number of folks who have participated, on average, they're saving over $600 or more a year, because of participation in this program. And we've also seen that a lot of folks have been able to reduce their debt. So I think this is another important program that I would encourage folks to check out if you're concerned or interested in your own financial health and well-being. Next slide. And then another program that we've really seen an increase since COVID is our Sage National LGBTQ plus Elder Hotline. This program is designed to provide a friendly voice at a time when you may be in need. You may be looking for resources in your community. Someone may be feeling a little down and just wants to be able to pick up the phone and talk to somebody. And this program, we actually have seen a huge increase in its use since COVID. Prior to COVID, we were seeing about 30 to 60 calls a month. And on average now, we're seeing closer to 400 calls a month. So this program has really provided an important lifeline to LGBTQ plus older adults across the country. Our three top states for receiving phone calls are New York, Florida, and California. So we really encourage you to, share this number with, folks in your circle who may be needing to reach out for services and support. Next slide. We also wanted to just think about housing, and we have our National LGBTQ plus Housing Initiative. This program works with housing developers across the country who are looking to develop affordable housing. And through this program, you'll be able to see where some of the LGBTQ plus friendly housing is currently being developed or has already been developed and is accepting applications for residents. So we would encourage you to take a look at this website if you're looking for housing across the country. Next slide. Another program that we're involved with is the Long-Term Care Equality Index. This is a joint program between SAGE and the Human Rights Campaign Foundation. And this program specifically works with independent living communities, assisted living, and skilled nursing communities. And I like to say that, one of the efforts of this program is to really take long-term care communities beyond just waving the rainbow flag. But it's really about investing in their own policy and procedures, making sure that they have practices in place that truly support LGBTQ plus older adults, their caregivers, and their employees who identify as LGBTQ. So we have a number of best practices that we're not only asking organizations to review and update, but we're also asking them to share those policies with us. So we actually know that they've made a true commitment and they've actually made changes to their policies and procedures. We'll be releasing the first report on the LEI, the indexing survey in, I believe, March or April of 2023. And when this report goes live, you'll actually be able to see a list of providers across the country who have made a commitment to long-term care equity for LGBTQ plus older adults across the country. We're currently working with over 100 providers across the country, and we know that this will only grow over time. So we're really, really excited about this program. And next slide. We also developed a toolkit for older adults themselves. So if you're looking for long-term care communities across the country, this guide is provided to help you evaluate those providers, to help you, consider questions when considering, where you're going to live, where you might retire, or if you're looking, to provide skilled nursing placement for a loved one. There's a series of questions that you can review and ask of the provider to encourage them to be LGBTQ plus inclusive. So we would encourage you to take a look at this guide. And as Jackie had indicated, there's hyperlinks throughout this slide deck, so you'll be able to click on the links and go directly to these resources on our website. Next slide. And finally, here's my contact information. So if there's anything that you would like to have more information on, or if you have questions about some of the services and programs I've talked about, please feel free to reach out and I will get back to you with an email and help answer your questions or point you to additional resources in the community. And with that, I will turn it back over to Andrea.
Cheryl, that was terrific. And all the information that she shared will be in a follow-up email as well as on our website in the next few days. So don't feel like, you have to scribble those notes down. We've got that information for you. Jessica, when you're ready, you can pull up my slides. Thanks again, everybody. This session here at ElderSource is really part of our strategic plan to be all-inclusive in the services and programs that we offer at ElderSource. Next slide. Our mission at ElderSource is to empower people to live and age with independence and dignity in their homes and communities. That's a lot of information right then and there, but I want to focus in on the word independence. I mean, I do a lot of community outreach, and one of the quotes that I use in the community is, people fear losing their independence more than they fear death. So all these resources, information, and context that you have here today, we want you to be have the access to those resources. That's very important to us as personally and professionally here at ElderSource. We are, next slide. The area that we serve is up in Northeast Florida, 7 counties here in Northeast Florida. And we are what you call the Area Agency on Aging and Aging and Disability Resource Center for Northeast Florida. But we have sister agencies, 10 others in the state of Florida. But if you have a family member who might live in Denver, or they might live up in the state of Washington, the area agencies on aging are all across the country. There's about 620 of them. And next slide, please. We are funded by state and federal dollars, and through the Older Americans Act. That's how we're all connected through the area agencies on aging, is through the Older Americans Act. And here in Florida, we're also funded by the Florida Department of Elder Affairs. We are a nonprofit organization. Grants and donations supplement a lot of the work that we do, in addition to the funding that we get from at the state and federal level. And this particular program is funded by the LGBTQ fund at the Community Foundation for Northeast Florida. So we look to those other partners and providers to do work that we feel is very important to meeting our mission. Next slide. About us, we've got a staff of 70. Our core business is information and referral through our helpline. And we fund senior services in all those areas that are mentioned there: Volusia County, Flagler County Senior Services, the Councils on Aging in St. John's, Nassau, Baker, City of Jacksonville. We also work with another organization called Aging True, and they cover senior services in Clay and Duval. But our main office is located in Jacksonville. Next slide. So when I mentioned those partner agencies in all those counties, we do not provide the direct services, the Meals on Wheels, the senior center activities. Those come from the funding that our partner agencies get from us, but we all work together to provide you with those resources and support that you need. And they run the gamut of the respite care, the adult day, in-home, legal assistance. So when our tagline is "Start here for help," you might be sitting at your kitchen table and you don't really know, gosh, I've got maybe 1, 2, 3, 4 different things that I'm concerned about. Calling our helpline is the place to start for help, which I think is my next slide. Yes, so as I mentioned, our helpline is Monday through Friday. We get over 6,000 calls a month. At the height of COVID, it was 8,500 calls a month, and people call us for all different reasons. But the most reasons are for in-home services, housing, food. There's food insecurity. Unfortunately, with a lot of seniors, they're juggling between, do I pay for food or do I pay for my medications? So this is the connector. This is where people start at our helpline. Next slide. Jackie had mentioned a lot of information about Medicare. I would consider SHINE one of our most important programs. We have a lot of important programs, but as you turn 65 and you are faced with the choice of signing up or information setting up your Medicare benefits, Serving Health Insurance Needs of Elders is a SHINE program here in the state of Florida, and it provides that free and unbiased counseling on Medicare benefits. We have over 40 volunteers who are highly trained to understand all the complexities of Medicare. You know, a lot of people, when they turn 65, you've got open enrollment. Those are the kind of the most popular times, but those SHINE volunteers are available throughout the year, and they're trained and updated throughout the year on all the different aspects of Medicare. Several of our SHINE volunteers have been with us for 10 years as volunteers. It's almost like a full-time job. And they provide information on that prescription drug coverage, the Part A, the Part B, this, the low-income subsidy. You know, you may be eligible for some extra support that puts money back into your pocket. One of the things that has gotten, unfortunately, a lot of attention is Medicare fraud. So the Senior Medicare Patrol, which is a little sub-program of SHINE, helps you you maybe tackle that idea, and you look at your Medicare bill, or somebody's calling you incessantly about wanting to sell you a neck brace or some sort of equipment, and essentially they're trying to collect your personal information. We will help you gather that information and make it a report to the proper authorities. Next slide. Benefits Enrollment Coordinator. We have 2 folks on staff who help those low-income seniors provide some extra assistance. I mentioned that extra help program through the Medicare Part D, and also the Medicare Savings Program, but also getting people signed up for SNAP, which is the Supplemental Nutrition Assistance Program, also known as food stamps. Next slide. Caring Connections. We have some terrific programs that support caregivers specifically, to the Telephone Reassurance Program, the Virtual Caregiver Support Group, our Active Daily Living Caregiver Library, T-Care, which focuses on caregiver burnout, and powerful tools. So let's talk about telephone reassurance for a minute. So the Telephone Reassurance Program really helps, particularly during COVID, reduce that isolation, stress, and depression and anxiety someone might feel because they're living alone and they don't really have anybody calling on them. So we have trained volunteers who are background checked to make those friendly calls. Some of our people that we've called upon have been so touched by the people who are calling them that they in turn want to become a volunteer for our telephone reassurance program. So I love it that she's got 400 calls going through her help telephone reassurance program. And we too locally have those individuals who are so ready, willing, and able to be that friend that you might need. A little check-in once a day or twice a day. Next slide. Our virtual caregiver support group, we actually started this prior to the pandemic. And it is a place for those caregivers who unfortunately, they're not able to get out of the home easily enough to attend a focus group or attend a support group. So they are connected through their smartphone or some other smart device for these sessions that give them the ability to connect with other caregivers who are walking the same walk. So we're encouraging people to, you know, don't sit at that kitchen table alone. You know, connect with us and connect with others caregivers through the support group, the virtual caregiver support group. Next slide. Active Daily Living on our website is a really, really cool feature. It's a cool portal where you can access videotapes, blogs, how-to videos, anything that might help you be a better caregiver or help you continue to age in place. The age in place guides, those quick tips. There's tips that, for example, you have a loved one who's having difficulty putting their socks on. There's a cute little video in there that explains, here's a little household tool that you can use to, you know, get yourself dressed with ease. So this whole library, again, is free and on our website. And you can even tailor a little newsletter to come directly to your inbox that focuses on, you know, some real specific information that's geared to what you're interested in. One of the most important or popular topics that people tend to be gleaning from this aspect on our website is all the information about dementia and living with Alzheimer's. So I'm seeing on the back end of our website that this is a very important resource that people are accessing through the Active Daily Living on our website. Next slide. T-care, tailored caregiver assessment and referral. Burnout. I think if you've been a caregiver, you're tired, you're stressed, you can't get enough done in the day, you're having a hard time taking care of yourself. This particular program, thankfully funded by a generous grant from the Florida Blue Foundation, helps reduce that stress and provide strategies for reducing that root cause of caregiver burnout. A care plan is developed specifically for you to identify those stressors, and then tactics and strategies that you can do to take better care of yourself and reduce that level of stress in your daily life as a caregiver. Next slide. Powerful tools for caregivers. Again, another wonderful program that we have. It's 6-week classes. It's designed, held once a week over the course of 6 weeks. It gives caregivers those tools that you might need to give you that self-care, to reduce that stress, changing that personal negative talk that may be weighing you down, how to communicate with your family and members and healthcare service providers with some of those tough questions, and dealing with those difficult feelings, and so much more. All of these programs that I mentioned, next slide, are free, and it's just call the helpline. Say, I'm interested in those caregiver support resources and tools that you have. There's also a special place on our website where you can read a little bit more about those items that I've talked about. You can email caregiver support at myeldersource.org or info@. Go to our website, and of course the helpline 1-888-242-4464. All those information and bits of resources that I've talked about here are going to be shared not only after this particular webinar, but we're available to talk to you at any time. So let's see, I think we might want to jump to our questions. And Cheryl, I think you had a couple. If you want to start with yours, and I have a few, we can jump to those as well.
Sure. So Jackie, I had a couple of questions I wondered if you could maybe share a little bit more on. So the first question was, if somebody's thinking about their own potential caregiving needs, and maybe they don't have someone that they feel they can name as their durable power of attorney or healthcare proxy, do you have ideas on how someone can maybe start to engage with friends, maybe even distant family members to step in and maybe support them in that caregiving role?
Yes, absolutely. And that's why I said, like, don't discount anybody, because I've seen really unique connections be made at later on in life. So for example, I've had clients who were exes, right? Who were together for 10, 20 years when they were younger, divorced, separated, and then when they start to decline, decide to live together or show up for each other because they have the strength of that relationship. Likewise, it could be a neighbor or a friend, a person who, genuinely is concerned and just checks in. We've had those situations more times than I can count. So when you're struggling and you're saying, gosh, I don't really feel like I have anybody that's that close or that intimate of a friend that I would feel comfortable sharing, there's two reasons for it. One is we're not practiced at asking for help, right? So that's the part that we all have to deal with, to say, all right, I got to let somebody in around my healthcare and around my finances. And that's not going to feel comfortable because I've never practiced it. Most of us don't do that. And so, of course, it's going to feel a little uncertain, but don't let that stop you from starting the conversation. So I always just say, make a list of the people you know and start to hone in on who's good with money, who do you trust and like around medical care, and just start the conversation. These are long-term relationships. So for example, with my folks, I've been talking with my people for 10 years. And just this year, I saw some behavior that actually is going to make me change my power of attorney, because the power of attorney that I had, I was like, I actually don't know that she'll be that great in a crisis situation. I thought she would be, but I don't know that she will be. So it's okay to change, but start the conversation. I check in with my power of attorney once a year to help build the trust, say what's shifted with my healthcare, and practice having those conversations. You know, I always go on too long, Cheryl. I'm a
No,
hush.
I want to piggyback off of that a little bit. How many times have you said to somebody, what can I do for you? And you say, oh, they say, oh, no, nothing. But, you know, many times in a crisis situation, people have offered me help and I've refused it. But you know what, if you think about it, you're really giving that person a gift. You know, you need the help, you need to speak up, but also think about what you're doing for them. They wouldn't have asked if they didn't really mean it. So I think about it that you're giving that person a gift instead of taking advantage of them. But tapping into those experts that you know, those people that you trust, I think is really key, particularly as we age. And you know, we're uncertain about sometimes where do we turn for help. Following up with a little bit of what Cheryl had just asked, those difficult conversations. Do you have any tips on having a difficult conversation? And I'm not necessarily talking about death and dying, but just bringing up a difficult conversation or topic with a family member that you've been waiting to have it, or you've avoided having it. Do you have any thoughts on that, Jackie, about how to get that conversation even started?
Yes, I certainly do. And these are the places where I think people get very, very frustrated, because oftentimes you might be that person trying to have the conversation and there's no response or there's defensiveness. We see that a lot. And that's because those family patterns don't go anywhere. So, you know, if you all didn't get along when you were kids, if you had slights from years back, that's going to all be there at that table when you're trying to make decisions. So the first thing I say is like, just get folks to the table without your agenda. So you may have an idea of what you want to talk about, but leave it open for their concerns too. It can't just be a one-way street where I'm the caregiver and I'm talking at my family and telling them what they need to do. People aren't going to respond to that. So what I'll tend to do is just say, you know, there's some things changing with mom and dad. I think that, you know, we should all talk about it because I know we all care about them. So I'd love to give some updates, hear you all's perspective, and kind of make sure that we're on the same page. That simple, that simple. And then try to structure like, maybe we should check in once a month so that it's an ongoing conversation, because you're not going to make all these decisions in one call and it's going to feel stressful. So that warm invitation with room for them to bring their concerns to the table and ideas to the table is what I've seen be most effective. And I also say, like, don't give up. Don't give up, because this stuff is scary for a lot of folks. And if you're the one who's really capable, who's trying to, you know, lead the charge, just because people aren't responding or they aren't showing up like you doesn't mean they're bad people and doesn't mean they won't show up. So giving some room and space and graciousness to be like, okay, sis, maybe you don't have capacity right now. When and if you're able to support here, I'd love to talk with you. We'll be ready when you're ready. You know, just so, which is hard to do. It's hard to do, but I call it putting my customer service hat on as a caregiver instead of like that sibling or that family member. So hope that helps.
That does, for sure. A couple of things that I just wanted to reiterate. There was somebody wanting that information about the Veterans Directed Care Program. So that is something that we started several years ago, that veterans who, most of them, if not all, that we have been caring for of late are terminal, and they need and want to have a caregiver at their side. So the program allows you, and again, everything starts not necessarily with ElderSource, but through the VA that's in your area. You call the VA, talk to your primary care physician, and then they can refer you to this program where you can hire a caregiver anywhere from $15 to $20 an hour. We help you set the budget. We work with the VA to give you a budget of what you would be working toward to paying those individuals. And there is payroll and there is paperwork to fill out for all of this. But the bottom line is you get to choose the caregiver. And then they get to have some supplemental income that goes along with that particular care. So it's an excellent program and it's growing tremendously. So here in Florida, we work with the VA out of Orlando and the VA out of Gainesville. And then other parts of the state with our sister agencies, they work with the other VA programs there. So I want to make sure that people are aware of that. They don't even know that it was even available to them. And I just reiterating about SHINE, serving health insurance needs of elders. Medicare is confusing. Jackie, you said it, and I can even begin to tell you the conversations that I have with people out in the community. You know, their eyeballs are twirling and they're turning 65, and there's so many people that are knocking on their door saying, pick me, and you want somebody at your elbow to help you understand what your benefits are and getting things signed up in a proper way that you feel like you've got, you know, sound, sensible Medicare coverage. So that's really, really important. Cheryl, you had a ton of those links on your presentation. And the one it's almost like the Prepare to Care. I think that Jackie was the author. What are some of the topics in there that are, would you consider some of the most important things to hone in on?
Just, you know, listening to this conversation right now, one of the things that came to mind was, in that guide, we talk about, as someone who may be preparing to receive care and maybe starting to think about asking for help, one of the main recommendations is to start your own list. These are the things that I need help with. These are the things that I would like help with, so that you're in control of that process. So when somebody comes to you and says, what can I do to help? You're prepared. And, you know, people are asking to help, so give them that opportunity. And, you know, it may be things like, I need someone to walk the dog twice a day. I could really use help with running out and getting my prescriptions, or, you know, going to the grocery store for me. You know, we oftentimes today think about, you know, Instacart and some of the grocery delivery services. Well, it can cost people quite a bit of money for those services. And so for an older adult who may be, you know, already really having to watch their income, having somebody go to the grocery store and pick those groceries up for you can really help save them money over the long run. So being in control of what type of help you want when people ask to help can really be important.
I think that's really, really important. The other thing that I found interesting, I'm looking forward to the results, would be that affordable housing information. And here in Northeast Florida, affordable housing, I can't even begin to tell you how many top calls I've received and people I talk to out in the community. There are wait lists for those subsidized housing. And so what do you do in the meantime? So, and hopefully by calling our helpline, we might have some suggestions and resources for you to get out of that in-between spot until you can find that place. But that is a challenge, I think, all across the country, but particularly here that I'm aware of in Northeast Florida. So that map I saw that you had Florida colored in. So if I were to go to that part of your website, Cheryl, does it show me by county, by like what would I see for that particular
It
resource?
shows you, yeah, for that one, it shows you by state,
Okay.
you know, where the affordable housing providers that are specifically developing or have already opened communities that are LGBTQ friendly. And so that's a very targeted, you know,
Okay.
resource there.
Yeah. One last question, and I think then we'll wrap up here. This is for you, Jackie. What kinds of questions would somebody ask to uncover, discover if that particular healthcare provider or housing community is LGBTQ affirming? What do you ask?
Yeah, thank you so much. I'm going to share a slide on that, actually.
Oh, great.
Yeah, absolutely, because this is a question I get asked a lot. The first thing that you want to do when you're doing your research is ask around, ask your network. Who knows somebody who's had a good experience for whether it's housing or a physician or a caregiver service? Asking within your community, great first step. Then do your online research or connect with the Area Agency on Aging or SAGE to say, hey, what else is out there? Who else should I be looking at? And then you'd want to do an interview. You want to actually either tour the location if we're talking about housing, call the company, contact the doctor's office, ask some basic questions, and then it's the work of building the relationship. So these are some of my favorite questions to ask to try to assess, is this agency, organization, or person actually LGBTQ plus friendly? Because if somebody is, there's a difference between, kind of the we welcome everybody and, the actual intention around, we've done training, we've put some resources behind this, and we are actually showing our commitment. So these are some of the questions I use to get a sense of where's this person or agency at. Do they currently serve LGBTQ plus people? What has their training and commitment been to this community, right? Have they ever done any training internally on LGBTQ plus care? Do they hire from the community? What policies and procedures do they have in place to protect against discrimination? For example, with what we have going on the national stage right now, with Roe v. Wade, and then potentially some changes or looking at other policies that impact LGBTQ plus folks, I have clients that are saying, well, if we're married, but then for some reason marriage equality doesn't happen, I need to be sure that my facility that I choose is still going to let me live in a room with my same-sex partner. So you may have specific questions to you that you want to know the answer to, right? It can be something like that. It can be, what would happen if I was verbally harassed or physically harassed? What's the policy on that? So that you're sure that that facility or organization actually has the procedures to back up what they say, how they say you're going to be treated. How much time do they spend with patients? How are emergencies handled during off hours? These are, again, some of that responsiveness, safety issues that you might consider. So I hope that helps.
That was exactly what I wanted to hear. Thank you. Jessica, if you can go to our last couple of slides, we're going to wrap up today. Thank you so much. Actually, this was Effective Caregiving Part 2. So we thank you to our speakers and to the LGBTQ Fund at the Community Foundation of Northeast Florida. And I would also like to mention, next slide, please, that the session's been recorded. It'll be available on myeldersource.org, again, with all the resources that are mentioned. I really hope that you tap into them and share the recording with people as well. Next slide. Thank you to Cheryl and Sage and Jacqueline Boyd, a fabulous subject matter expert. We're going to be taking a little bit of a summer break, but we'll be having our last 2 sessions in October and November. The dates are going to be announced, but the next one is going to be a financial checkup, which will talk about the resources that you need to be the best caregiver and taking care of your financial needs as you age well. Last slide. Thanks, everybody. And we thank you for attending. If you can, stay on for a little bit. That survey is going to pop up, and we would love